So, after this worrying introduction by Anthony Fauci, let us move to the first presentation, which is by Emanuele Capobianco. Emanuele is the Director of Global Health Security at GAVI, the Vaccine Alliance. Please, Emanuele.
Thank you very much. Good morning, everyone. It's a real pleasure and an honor to be in these wonderful settings with all of you. I'll try to be optimistic as much as I can to counterbalance Professor Fauci's presentation. I come from GAVI. GAVI is a public-private partnership that was established in the year 2000 to bring vaccines and increase utilization and access to vaccines in low-income countries, and 1.2 billion children have been vaccinated since then, saving more than 20 million lives. I will be focusing on a few of the pandemics, similarly to what Dr. Fauci did earlier, starting from a pandemic that has been very close to all of us, COVID-19, a pandemic that is moving into the past now, smallpox, and another one that has a much lower impact, and you can see the bubbles are clearly linked to the mortality of each of these outbreaks. But before going in these three examples to talk about how vaccines played a role, I just wanted to go very quickly back to the Spanish flu, because the Spanish flu represents an archetype of a pandemic for which there were no countermeasures and only public health measures could be put in place. And this is the archetype of a virus that spread across 1/3 of the global population, killed 50 to 100 million population with huge societal impact. It is believed that the resurgence of fascism in the 20s may have been linked to that pandemic, and so the expansion of protectionist economic policy in a large part of the world. I want to take you back to smallpox, because smallpox has been one of the biggest killers in history for centuries. It decimated Latin America when the colonization by Spanish and Portuguese troops happened in the 1600s, and has been a deadly disease until 1796, when a doctor, Dr. Jenner, discovered that people that were close to cows who had cowpox seemed to be protected by smallpox. And so he decided to take a material from a lesion of a cow and inject it on a child. By doing so, he immunized and discovered that this was working in immunizing the child that would not be infected by smallpox. The word vaccines comes from the Italian vacca, which is cow. And that's because it's linked to this discovery. It took 15 years from Jenner's discovery to have vaccines that could actually be distributed. It became mandatory in 1850 in the US, in the UK, and in other countries. But it took another 100 years to have all member states at the WHO to agree on one of the most ambitious, probably the most ambitious public health programs ever, the program to eradicate the disease. Smallpox. This was a world that was at the height of the Cold War. This was a world that was not globalized, and yet, in less than 30 years, smallpox was officially eradicated. And as Dr. Fauci said, this is the only human virus that has been eradicated to date. The role that the vaccine played on this was critical. We had a vaccine that was thermostable and was able to be brought across the world to lead to this remarkable result. This is, for me, is landing on the moon from a public health perspective. Let me take you now to Ebola. And Ebola, as Dr. Fauci said, was discovered in 1976. There were a lot of outbreaks that happened primarily across Africa that were self-contained. It's a very serious disease, hemorrhagic fever, mortality 50%, but can go up to 90%. It really garnered worldwide attention during the West Africa outbreaks, where 28,000 people were affected, more than 11,000 people died. It was a watershed moment for global public health. CEPI was born after that. Africa CDC was created after that. Major reform in the World Health Organization, because it was, in many ways, a failure of the global response to a major outbreak. One of the silver lining was that during that outbreak, the vaccines for Ebola was, a clinical trial was conducted, and after that, and it was, the successfulness of that was proven, and after that there were investments that were also supported by my own organization to ensure that there would be a reserve of investigation of vaccines, small, that could be used even before licensure for the next outbreak. And sure enough, in 2018, 2020, when there were the outbreaks in North Kivu and in Bandaka, more than 300,000 people were vaccinated through this vaccine that was available and was brought to license after. And then this really contributed to a much reduced mortality compared to the West Africa outbreak. Now, the good part of this story, I mean, is what happened afterwards. The vaccine was licensed, and then there was a decision to create a global stockpile that is financed by GAVI, supported by the organization that you see listed, that allows these vaccines to be made available whenever there is an outbreak, anywhere in the world potentially, within 24 hours. The September outbreak in DRC, in Kasai, has been responded to with vaccines that were mobilized from this global stockpile. And this is not the only global stockpile. GAVI is financing global stockpiles for yellow fever, for meningitis, for cholera, and as of next year, thanks to a decision that was taken by the GAVI board in July, there will be now a global stockpile for Mpox as of next year. Going to COVID, Dr. Fauci has already talked about the role of vaccines, and he presented what is an extraordinary achievement, the ability to move from the sharing of the genome sequence on the 10th of January to December 2020, when the first vaccine were inoculated in the UK territory. That is amazing. We have solved from CEPI on that side of the world 326 days. We can bring it down to 100. That's the challenge that we do have, and we have the potential to do that with new technologies, mRNA, and with proper investment behind that. Another critical feature of the COVID response from a vaccines point of view was the creation of COVAX, a facility that was aiming at bringing vaccines in low-income countries. GAVI, CEPI, WHO, and UNICEF worked together to bring 2 billion vaccines in low-income countries, with the first vaccines hitting African continent and Rwanda and Guinea within 39 days from when it has started in high-income countries. Again, a massive result. That said, if we look at the coverage of the world, inequity was the word of COVID-19. Low-income countries, and particularly African sub-Saharan countries, received very few doses compared to high-income countries that ordered vaccines. This is a major issue that needs to be addressed for the next pandemic. And similarly to what Dr. Fauci said, I'm also referring to the study by the Imperial College that demonstrated that an estimate 20 million lives were saved during the first year of rollout. So what I wanted to bring here was three messages. One, we do have the possibility to eradicate a disease through vaccines. We have done it. We are trying to do it with polio. We are close, but it's been a very difficult battle to close the loop. We have stockpiles that can allow to respond very quickly to the emergence of a disease to avoid this from expanding into global threats. And we have demonstrated the ability to come up with new vaccines very quickly to respond to major outbreaks and pandemics. So there's a lot of optimism on this side. I want to bring a little bit more optimism to the table before I conclude, and these are my last two slides. We have talked about vaccines for communicable diseases, but we are already having vaccines that are addressing non-communicable diseases and other pandemics. Through vaccination against hepatitis B, we are protecting people from liver cancer. Through the expansion of vaccination against the human papilloma virus in young girls and boys, we are protecting millions of girls and women from cervical cancer. And the future may bring vaccines against melanoma, against lung cancer, against pancreatic cancer. And this is quite exciting. The future is also addressing the issue, and the present is addressing the issue of inequities by shifting the capacity, manufacturing capacity, where there was no capacity until recent times, and primarily Africa. GAVI is supporting the African Vaccine Manufacturing Accelerator, and that will hopefully help the health sovereignty of African countries and make sure that vaccines are available, manufactured locally, immediately after a vaccine becomes available. New technologies are coming, and some of them are quite exciting. We're going to have patches for vaccines rather than injection, and that will change, hopefully, the perception of some. We are going to have, hopefully, thermostable vaccines. And I know Ilaria cares a lot about those ones. So vaccines that do not require a cold chain of -20, -80 degrees are very difficult to maintain, very expensive, complicated. Those will be game changers. And then we are going to have mRNA vaccines that again will allow very speedy production of vaccines. Last point on that very quickly is AI is clearly opening new opportunities, and this is related to the vaccine discovery and design, but is also linked to the clinical trial optimization and also to improvement in manufacturing and supply chain. So again, there's a lot to be optimistic about, but I cannot be too optimistic, so let me take you to my very last slide, where I need to refer to some of the elements that are critical for continuing on a positive note. There are 4 elements that I wanted to share with you as elements that, in my opinion, are critical for this ecosystem to function. Investment in research and development. You cannot produce a vaccine during an outbreak. You need to prepare before, you need to invest before, years before. Cuts in mRNA platforms right now that are working for potential flu vaccines are potentially having an impact in a few years' time should we have a pandemic that could cost millions of lives. Second, rapid financing for response. One of the excellent outcomes of COVID, if we can talk about excellent outcomes, was the creation of the pandemic fund. Priya will talk about that. In GAVI, and here I want to thank the Italian government and Francesca, we created a first response fund of $500 million backed by 1.5 billion credit lines that can be activated within 24 hours to move the response or the vaccine response as soon as an epidemic is declared a public health emergency of international concern. And we have used this facility last year for mpox, and that has been tremendously helpful in responding more promptly to this outbreak. Third, and I'm sure we're going to spend the next 2 days around this, political will and global coordination. In May this year, the World Health Organization, the member states, approved the pandemic agreement, with some notable countries missing, US not participating, but even my own country not signing up to that. It's a very hopeful sign of what multilateralism still can do in a world that is retreating from that. Is also something that will be very difficult to implement and enforce, and there are still discussions on the PABs ongoing right now that are quite challenging. So this will be a space to look at, and I really look forward to the discussion in the next few days. I want to conclude with this point, which is very close to me, which is the community engagement and trust. You can have all the most beautiful countermeasures, either vaccines or a pill that is magic, but if people don't want to take them, you don't go very far. So building trust, building community engagement is critical. We have done a lot of work to reach the last mile, to bring vaccine and countermeasures to the remote health facilities. The challenge right now, or one of the challenges, is the last inch, is that distance from the fridge to the arm is where you get the trust of people, which is a trust on the public health system, which is a trust on whatever societal principle and values are behind, which is a trust with the political system in which we are living. And with that, I thank you.
Thank you very much, Emanuele. And